Hello everyone, how's it going? Facilities that provide mammograms will soon be required to provide information to patients regarding the density of their breasts. Well, what are dense breasts? How common are they? And if you have dense breasts, is a mammogram sufficient, or are other tests needed in order to screen for breast cancer? If that sounds interesting to you, then keep watching. So what does it mean to have dense breasts? I know before I did the research, I thought that being overweight could cause someone to have dense breasts, but that makes no sense at all once I learned what it means to have dense breasts. But later on, we're going to actually discuss who are more likely to have dense breasts. Now, breasts consist of three kinds of tissue: fibrous, glandular, and fatty. Breast density is a measure of how much fibrous and glandular tissue you have in your breast compared to the fatty tissue. It has nothing to do with breast size or firmness. The only way breast density can be confirmed is by getting a mammogram. So there's actually four categories when it comes to breast density. If you're in category A, that means the breast tissue is almost entirely fatty. If you are in category B, you have scattered areas of fibroglandular density, which means it's mostly fatty tissue. If you're in the C category, that means you have heterogeneously dense breast tissue. So most of it's dense. There's some that's fatty. If you are in category D, it's considered extremely dense, which means the breast tissue is nearly all dense. There's just a little fatty tissue. So for those who are in the C and D category, they actually have dense breasts. And if you have dense breasts, that means you have a relatively high amount of glandular and fibrous tissue and a relatively low amounts of fatty tissue. Well, how common is it to have dense breasts? Well, nearly half of women over 40 who get mammograms actually have dense breast tissue, so it's very common. Well, why is it important to know if you have dense breasts? Well, we're going to answer that in a moment, but before, I'd like to remind you to please like and subscribe if you're enjoying today's information. Also, make sure you check out the links below. You can actually see where I gathered the information for the video. And if you'd like to leave a comment on this topic, just feel free to leave that as well. So why is it important to be informed if you have dense breasts? There's two reasons. One reason being that it could be more difficult for a radiologist to interpret your mammogram images. And that's because dense breast tissue and some abnormal breast changes like calcifications and tumors, they both appear white on a mammogram. Now, this could actually make it harder to detect cancer, especially in the early stages. On the other hand, fatty tissue actually appears as dark areas, so it's a little easier to differentiate. The second reason it'd be important to know if you have dense breasts is because dense breasts are a risk factor for breast cancer. And this is a separate issue from what we just talked about, with it being hard to distinguish the difference between dense breast tissue and some abnormal breast changes. Now, experts don't know why there's a greater risk, but one reason may be that cancer cells often grow in glandular tissue. So, by September 10th, 2024, all mammogram reports sent to patients, they'll be required to include breast density. Also, the reports sent to your provider will have to have an assessment of those four categories that we just talked about. Now, many facilities are actually already doing this, which is great. So if you have dense breasts, do you need additional testing? Well, experts do not agree whether or not to do additional testing, so it's important to talk to your doctor about your risks, learn what is recommended based on your personal and family history. It is encouraging, though, to know that while it might be harder to detect cancer, especially in the early stages, when someone has dense breast tissue, mammograms are actually still quite effective. Nearly all mammogram machines in the United States, they make digital pictures. So that means the healthcare professional is actually able to zoom in and get a very detailed view. Also, most facilities in the United States now offer 3D mammograms. So they use computers to combine X-ray pictures of the breast into a 3D image. And this allows them to see actually past areas of density. Now, depending on your preferences and your risk, your healthcare provider may actually recommend some additional testing. Some evidence shows that a breast ultrasound or a breast MRI may be able to detect some cancers that may not be found on a mammogram, but they need to do a little bit more research on that. There are two problems that come up when you do additional testing, though. One being that sometimes these tests find something that may report as abnormal, which would require additional testing, like maybe a biopsy, only to find out later that there is no cancer. It's called a false positive. Now, the second issue is that these additional tests, these biopsies, they may not be covered by insurance, so that might actually cause a lot of out-of-pocket expense. So let's talk about who are more likely to have dense breasts. Like I mentioned before, I thought it was those who were overweight, but it's actually quite the opposite. Those with lower body weight are generally more likely to have dense breast tissue. Also when a person is younger, if they're pregnant or breastfeeding, or if they are taking hormone replacement therapy, they're more likely to have dense breasts. Now, women tend to have less breast density as they age, but some people actually see very little change as they get older. Oftentimes, the breast density we have is just what we've inherited. Interestingly, I read that the majority of people who develop breast cancer, they don't have any known risk factors. And when you think about how 1 in 8 women will actually develop breast cancer in their lifetime, it really shows how important screening can be. It is comforting to know that most breast cancers can be seen on a mammogram, even when someone has dense breast tissue. Healthcare providers, they usually recommend those with average risk to get a mammogram starting at age 40, and then they'll recommend most people to just have that redone every year. So if you receive a report that says that you do have dense breasts, just keep in mind that it is very common and normal. Also, people with dense breast tissue are no more likely to die from breast cancer. So that's another encouraging thought. But you definitely want to talk to your doctor about what screening options would be best for you. Well, I hope you've enjoyed today's information, and I hope to see you in the next video where we'll discuss another way we can improve our health.